Welcome, Gyno-Curious listeners. I am Dr. Amy Novat. We are here to investigate what it means to be a healer and to be healed. Today, I have the privilege of spending some time talking about the perimenopause with Allison Chawla, a Rhiniecliff native, a mom of 2 daughters, a therapist, and a certified coach and alternative healer who is trained in both Eastern and Western practices. Welcome, Allison.
Thank you for having me. I love your intro.
Thank you.
Both sides of the speculum. That was genius.
It's just, especially as the ages move on, I find myself on both sides.
Yes.
Yes. Yeah.
Fantastic.
So the first thing I just want to clarify for our listeners is, what is the perimenopause? So it actually means around menopause and refers to the time when a woman's body is moving towards that last menstrual period. It can also be called the menopause transition, climacteric stage, or anovulatory years. Women start perimenopause at different ages, but for the most, the transition starts in their 40s and can last even up to 8 years. The average age of the last menstrual period, or the menopause, is actually 51 in the United States. So during this time, what's happening? The level of estrogen becomes less predictable, your progesterone levels start to fall, menstrual cycles may begin to change. Lighter, shorter, longer, heavier, and symptoms like hot flushes, mood, libido, sleep changes may start to become a part of your life. I remember personally, the first sign for me was lots of no sleep. 3 to 4 hours at most is what I got, and that was my intro. So, Allison, what I find amazing is that despite 51% of the U.S. are women, and that most will live beyond their 60s, i.e. will experience the perimenopause into the postmenopause, and we're just beginning to openly discuss the perimenopause. Why do you think that's true?
I think there's a tremendous amount of shame that's been imposed upon women, that we are supposed to always be these constant blooming, flowering beings that are not allowed to drop petals, if you will, and we're not allowed to wilt. And I think that pressure has come from multiple angles. And unfortunately, as far as we've come, it's absolutely still there. I mean, I think there's a lot of embarrassment. I personally don't feel embarrassed about it. I'm actually looking forward to not having my period when that happens. It hasn't happened yet, but I'm looking forward to that. But I think that there is just a stigma placed on us that as women, we cannot age in the same ways that men can. Whereas I've even heard someone say, well, men age like fine wine. I'm like, well, what do women age like? I feel like I'm aging like a fine wine too. But that divide is still present.
It's funny, somebody once said that to me, that comment that men age like fine wine, and they're like, and what about women? I was like, fiery vinegar.
Oh, that
watch
too.
out for us,
Yeah, you better watch out.
My perimenopause was really hellish. And so even with all the knowledge that I had, it was not fun. And so when I finally had my last menstrual period, I was really happy.
Yeah.
And I think there are so many reasons why there's this misogyny and lack of respect for the elder woman, unlike in other cultures where there's a great deal of respect.
Indeed.
Just culturally.
Yes.
But in the United States, there's just something about the way advertisements, politics, novels, the world of fiction, I mean, really, you name it, where women aging were seen as just aging, old crones.
Yes, and sort of be disposed of.
Absolutely, and
Yes.
replaced.
Indeed.
Replaced.
Oh, and I think that's probably the most powerful variable. I was just thinking about this yesterday. I have a friend who is with a gentleman that is about 10 years younger, and someone made a comment, and I said, men have been doing this for centuries. Men have replaced their partners as they became older, and no one has judged them. But when women do something like this, it becomes an issue when they're put under a spotlight. So I agree very strongly with that.
Yeah. And it's interesting how for so many years, sometimes decades for women in their menstrual life, there's this rhythm that we come to know as the rhythm of our menstrual cycle. So, 3 days before my menses, I get a little crabby. 2 days before my period, I feel a little bloated. Then there's the day of my menstrual cycle and all that comes with it. So there's this tempo, this rhythm, this theater, if you will.
I think you referred to it as a choreography, which is the most beautiful way I had heard it put, and I wished that throughout my life, all of these decades, I had thought of it that way, because it felt more like something I was dreading as it approached and something I had to apologize about to others. Like, I'm sorry if I'm a little on edge. I'm about to get my period. Versus, oh, I need to sort of behave a little differently, or I need a little extra sleep, or I need to go for a jog because my hormones are shifting and this is part of my dance that I do monthly.
Exactly.
I'd like my daughters to think of it that way, actually.
Absolutely. And I also think that if we give value to this experience in our lives, everything from the menstrual cycle into that place where we are having less of them, that we can celebrate being female, celebrate the changes that happen in our body rather than being fearful of them, loathing of them, shame around them. And I like to talk about that, the novel, The Red Tent, which of course alludes to the opportunity for women in tribal, pre-biblical times and even tribal communities, where when you're going to menstruate, quite frankly, most of the women in your community were also menstruating.
Yes.
And you got to go to this place where you got to just hang out and lie on a bed of straw and let your flow and all of the responsibilities that we have on the daily basis, childbearing, child rearing, cooking, cleaning, et cetera, just get paused. And I just love.
What a dream.
I know. I fantasize about it constantly when we are in a world where us women can dictate that. And I have a daughter who actually takes retreat during her menstrual cycles.
That's wonderful.
And I must say, as her mom, there's a part of me that's really nervous about that, because how practical is that in the world of 9 to 5? But thankfully, she's an artist, and she
can do that.
Going to carve out a life that allows her to celebrate her body changes and move through them with greater ease and an organic tempo, as opposed to the one that's dictated to us by the 9 to 5 job, or all those white men who are determining how we live our lives and work our lives, right?
And there's, if I may, there are two thoughts that occurred to me. First, since you've said the white man again, men are going through just as many changes as women are going through. Erectile dysfunction is something that many men start in their early 30s, which I did not know, but these things are not spoken about. They're going bald. Their bodies are changing as well, but the focus is placed on the changes that are happening with the female. And then the other thing is about this retreat, this break. I, for example, would have loved to know that I could take a break during my period when I was younger, because I had excruciating menstrual cycles to the point where the pain would be so severe that I would lose feeling in my legs. But I would go to school. I would do my job. I would work. I would take care of my children. It lessened a lot after I had children, but I don't think people realize how impactful this is monthly for women and how severe it can be, or just how emotional and psychological it can be. And we need a break.
Absolutely. And I actually think it's the beauty of the biology is if we were able to take a break, it would be a far different experience for many women.
Yes.
And we're here to talk about the perimenopause. And you bring up something, however, that I think we have to, again, mention, that there are some women who just celebrate the loss of their periods.
Oh,
and then there are women who really grieve the loss of their periods. And that for them, that means no more childbearing, aging for sure, and all those body changes. So as a therapist, you're speaking to women who are talking about both the grief of aging and perhaps the celebration of aging. What would you say to women who are going through this perimenopause around, I guess, the mood that comes with it?
Well, I would say that it's okay to feel whatever you're feeling, first of all, because again, that shame creeps in all of the time. So I would definitely say, like, you need to go with the flow, no pun intended, but go with what you're feeling. It's okay, because this is a change. And with any sort of change, of course, there is loss. But my psychotherapist once said to me when I mentioned, gosh, I think I'm in perimenopause. I'm sweating in the middle of the night. I don't know what's happening. And she must have interpreted it as a panic. And she said, what's incredible about not having your period anymore is that you become the most prolific version of yourself, because now you have so much more time for yourself versus planning your period, watching the calendar, buying whatever it is that you need for your period, running out for painkillers, or even being aware of the premenstrual syndrome so you can tell people around you what you're going through. So consider how much time is going to free up every month that you can now have only for yourself.
What a gift.
Isn't that beautiful?
What a gift. Yes.
Right after that, my sense of humor around it really evolved and my enthusiasm about the transition changed. It really was such an incredible gift.
Yeah. Yeah. I'm going to quote you on that.
Well, it wasn't me, but I'll tell you who it was.
The therapist of the therapist.
Okay.
Right? It is what often is true for patients who come into the office is the active word change. Again, we've talked about the choreography. We've talked about the ritual nature of our monthly cycles. And then during the perimenopause, what's beginning to happen, usually one of the first signs for women is that their cycles do begin to change. Every day I get a call about, I missed 3 months. Is that okay? Or I had 2 in a month. Is that okay? So change is something that I'd like us to talk a little bit about, because it's not just a change in this rhythm that we've talked about, but it's a change in the body and how to cope with that. And before I guess I ask you to answer those, kind of talk about that, I just want to point out for women, because often they're asking me, what are the changes that they need to watch out for? So I'm just going to insert that right now. And as our menstrual cycles begin to change, what we really want to look for is too much bleeding. I always say the absence of blood, no problem. If you've reached your 4th decade and you begin to miss periods, no problem. Of course, feel free to call your gynecologist and speak to them about that, because if they can reassure you, that's part of being well, feeling safe, and moving through it. But if you're having too much bleeding, what does that mean? It means you're bleeding more than 10 days. You're bleeding less than 3 weeks apart. You're bleeding so heavy, it is really hard to get out of the house, where your usual sanitary protection isn't doing it anymore. Or you're realizing, I'm changing a tampon every hour. Or your bed is filled with blood. Or even not the heavy flow, but where you have spotting every day of every week or every month. It's just too much. So I would say to any listener out there who's having this kind of pattern, that is really a time to speak to your gynecologist, because that can be an early sign of polyps, fibroids, precancers, or even cancers. And this is a result of having more estrogen on board than progesterone, and that change in hormonal relationship, being estrogen dominant, if you will, can cause these kind of growths. So what were some of the physical changes that happened to you first and foremost?
So for me, it was actually that when I had first gotten my period in my teens, I got it late. I was a late bloomer, 14, but I had gotten my period every 28 days on the minute. And then all of a sudden I was getting it every 2 weeks. So I thought, I must be sick. I must be dying.
Yeah, people go there.
I didn't realize that this is actually could be the onset of perimenopause. And that was, let's see, I'm 46 now. It started when I was 44. But I got it first every 2 weeks. And then it was 9 weeks. I didn't get anything. And my husband, we have 2 kids, but we can't get pregnant together anymore, we'll just say. And I thought, am I pregnant? And have I had some sort of immaculate conception? Like, what the hell's going on? But it really was that shift in the rhythm and the choreography. I suddenly did not have a calendar that I could rely upon. And it's very unpredictable.
Unpredictable. That is the active word. Change, unpredictable.
Very unpredictable.
Yeah, and that's very difficult for some women around their bodies, for sure. It's one thing to say it's unpredictable in their social world or in their children.
Right.
But when it's unpredictable in our body, there's something it can feel so disempowering, right?
For me, it didn't feel that way. As soon as I knew that I was healthy and that this was a normal thing, it didn't feel that way to me because, again, my body gives very clear signs when it's about to happen. So 5 minutes, before I can say, "Oh, I feel something. Oh, let me go grab a tampon. My period's coming." And again, it was a bit more freeing for me that I no longer had to check, "Oh, am I getting it? When's the last 28 days?" I could let go of some of that. But I could see for some how it really feels you're like taking all of the training wheels off that you've been using for decades and then trying to relearn how to exist around it again.
The image I often think about is as a sailor being on a sailboat, and all of a sudden the sails are full of wind, and then all of a sudden there's no wind. And that unpredictability about the status of your boat, pardon me.
Sure. You calling me fat now.
Hardly in your new getup, is so, again, it's new too. It's new to so many women. And just let me back up a little bit around that. Does every woman have a cycle every 28 days? Absolutely not. Even from the menarche, which is our first period, there are many women who their choreography is every 3 months, or their choreography is every 6 weeks, or their choreography is, I only bleed for 2 days and I spot and that's it. Where others are 3 days of really heavy flow.
Yes.
So the theater, if you will, if we're going to stay on that metaphor, the theater is different for every woman, and it also changes. So you may have a way of menstruating from age 15 to 25.
That's
looks
totally
one
changed
way.
too.
And then it changes from 25 to 35. And then if a woman decides to have children, then a lot can change. So change is something that us women face throughout the years. But this perimenopause is tumultuous in a way and provocative in a way that seems particularly nuanced and impactful.
It's a very nice way of putting it. I wanted to mention because we're talking about change, it wasn't really even the shift in my schedule that alerted me that something was happening. I could no longer, especially during the pandemic, like many people did, I would have a glass of wine at night. And all of a sudden, anytime I had wine, I would break out sweating. And I would be up in the middle of the night for 3 hours, not thinking about anything other than, why am I awake for 3 hours? Why does it feel like somebody played a prank on me and came in with a bucket of water and dumped it over my body while I was sleeping? That was the biggest indication that something was happening. To this day now, if someone hands me a glass of wine, I start panicking. I can't even have a sip because it triggers something, and I don't fully understand the science behind that, but just sweating and awake all night.
It's true, and we don't understand why red wine in particular.
Yes.
There are certain triggers for hot flushes. So let's talk about flushes. A change in the thermoregulatory system that is really universal. There are 98% of women during this perimenopause will have a hot flush or a night sweat. At one point. Now, some women talk about, I had it once, and that was it. And then, of course, there are women who come in and tell me they're having it every hour on the hour. Oof. And for some women, they're dry. They're just this wave of heat. And then for others, they are literally having to change their clothes. Yeah. And particularly persons who are in front of on stage or teaching, when they are having these flushes that are wet, it's particularly embarrassing. Talk about a feeling of shame and self-consciousness. And also what's interesting around these hot flushes is that many folks will describe a sense of disorientation. Yeah. It kind of, back to the boat, it rocks the boat in a way that they're like, where am I? What am I doing? How am I supposed to think? How do I wipe my forehead and talk about algebra in time? It's challenging. Yes. Yeah.
I've been lucky that it's only happened at night. And I think I've also been lucky that because I've been engaged with so many women, and, my mother-in-law was an OBGYN, my sister-in-law is an OBGYN, that I'm fortunate enough to have the information to not panic and brace myself and say, this is where you are in life. This is happening. And how fascinating that my body is capable of doing this. But I can't imagine how complicated and really just scary it is for other women to have it during the day and not really fully understand what's going on.
You bring up something that continually amazes me, and I mentioned it early on in my intro, was how many women walk into my office and really don't know what's going on and are feeling so frightened and uneducated and asking questions that are pretty basic around their body and their experience. And I'm always humbled by, one, how much information is out there and not out there. Yeah. And humbled by the diversity and array of experiences. And part of the reason that we're doing this podcast today is to just break through the silence, break through the shame, help women feel like they are part of a community, a very large community, 51% of us, and that this is a shift that they can move through, learn about, feel empowered around. And even when the nights are shitty and the days are hot, we're challenged by these physical symptoms, that we move through it.
Yes.
And that there's something really wonderful about learning about the body and feeling confident about the body.
Yes.
But boy, do we have a lot of women to talk about this with.
Yes, yes. It's very disappointing. Even when I come into the office and for my appointments, there's very little literature. And again, I feel fortunate that I don't need a lot of it for myself, but I even look for my very young daughters to be able to grab something and bring it. Because, nobody wants to talk to mommy all the time about private things, but there's so little information available that I just really think that's tragic.
Well, we're living in a time where women's bodies are becoming part of the political arena like never before. So if there's ever a time where you and I have to shout out loud about what's going on, it's now.
Yes, I agree.
And about all of it. And we're not just talking about choice in abortion services. We're talking about choice to decide, how am I going to treat the perimenopause?
Right.
So often women are asking me, so what do I do? What do I do about this? And just a brief list for our listeners is everything from, one, communicate about it. It can be so empowering. Two, herbal medicine and alternative therapies can be so healing. Hormone therapies, there are other medications, there is knowledge, and just continually moving through it with information can be so healing.
And don't drink red wine.
And don't drink red wine. You can have vodka, but not red wine. And those triggers, yes, let's talk about those triggers. Everything from closed-in rooms like this room we're right now in with no moving air, bedding that doesn't allow you to flip one sheet off and another one on. I like to talk about moving to a larger bed if you have a partner who generates heat.
So that's if I'm just going to interject.
Please.
My husband would say to me in the middle of the night, "Are you okay?" I said, "I'm fine. What's wrong?" And you are generating so much heat right now. And I don't think I can lay next to you. So I have started going into the guest room to sleep until this is done, which is fantastic, by the way. A whole bed to myself.
It's my favorite remedy for insomnia and night sweats is your guest
Go
bedroom.
sleep alone.
That's right.
But it really does have an effect. And I'm fortunate to have a partner. Again, he's the son of an OBGYN and the brother of an OBGYN. So he's very compassionate and he's, very much a feminist and supports me in doing this. But for someone that doesn't have a partner like that, it's got to be again, back to that shame. You're laying there, I can't do anything about this other than wait for it to move through me. I apologize it's affecting you, but I am certain there are people out there that get annoyed and irritated.
There's that dynamic for sure, where not only are women worried about keeping their partner awake, but how it might impact their next day's work. Or, heaven forbid, they are sleeping close enough that all of a sudden the sheets needed to be changed because there's a puddle of perspiration that's now creeping over to their side. These logistical challenges that happen, and women for just too many centuries have taken it upon themselves to be responsible for all these things. And again, feel shame about these things. And how could I let this happen kind of question.
Right.
And as we're pointing out over and over again, these are organic processes that I have wondered, what is the evolutionary benefit of them? And that's a whole nother podcast and really interesting reading.
Oh, I want to be on that too.
Yeah. I mean, what role possibly could be being awake in the middle of the night, other than maybe taking care of grandkids?
Right.
What is the role of perspiring so much that you've got to change your clothes? I don't know. Maybe it's good for the fashion industry. I don't know. There's a lot of sociobiology we could communicate about and talk about. But with that in mind, we are coming to a close. And I know you and I have so much to still talk about. And so I just want to remind folks that the perimenopause can happen also due to factors not just hormonal, but that if you're a smoker, you may have more perimenopausal symptoms. Family history. My mom, my sister, my grandmother, everybody had difficult perimenopauses. Cancer treatments and surgery that remove the ovaries that throw people into the postmenopause. These are all risk factors and lifestyle issues that can be sometimes modified and sometimes not. I would just remind women, please don't suffer in silence. There are books, there are friends, there are communities, there are physicians that I hope can help you speak about this transition with an understanding and respect and integrity. And Allison, I suspect you are one of those therapists who can help women with their mood and feelings of shame around this transition into aging. And so find women like Allison too.
Thank you. And I wanted to add something just because I don't want to sort of end on this note of if you're suffering, find hope. Something that I try to tell myself, and again, there are days where I haven't slept all night and I wake up and I want to cry and I'm in a terrible mood. So it's not like I'm this constant positive person out there. I'm still human, but I try to remind myself that my body as a woman has been capable of doing the most incredible thing that I could ever imagine, which is carry on the human race. A human being, 2 of them, grew inside of my body and then came out of my body, and my body continued to function as it did before that. And so when I'm going through all these experiences, I remind myself, anything that is that powerful, whatever it is that you think of, the ocean, a bomb, a flame, there is a tumultuous energy to it at times. So when I'm going through something that feels really exhausting and I'm ready for it to pass, I remind myself that this is just part of being a powerful woman and having the privilege of being able to do what my body did in this lifetime. And I think if we can remind ourselves that when the difficult times or the challenging things pass and we are still those beings, it can help you get through it a little bit easier.
Absolutely. And also to remind our listeners that this is not about illness. This is not ill health.
It's privilege, really.
It certainly is. It certainly is. And there's cultural issues that we can talk about with regards to this. There's again, so much to talk about. And when I was thinking about what to name this podcast, one of the phrases that I say far too often probably is that we are beautifully flawed.
Yes.
And that the power in the beauty and the power in the flaws are something to celebrate. So thank you, Allison. I'm so grateful that you're here today.
Thank you.
Me.
What an honor. Thank you.
Thank you also to my listeners for joining me as we venture into the limitless conversations about our bodies and the world of OBGYN. I would love to hear from you. Please email your questions and comments to comments@radiofreerhinecliff.org or call us at 845-307-7446. Also, thank you to my producers, Jen Hammoud and Matty Rosenberg. Until our next conversation, stay healthy and stand strong in your knowledge and your insights.